Welcome. You are listening to IJD in Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editors' highlights and a summary of our open access publications available to everyone.
Skin cancer represents a significant public health burden due to its high incidence, potential for morbidity, and, in the case of melanoma, substantial mortality. In the November issue of the journal, we highlight the different aspects of skin cancer prevention and equity. A European melanoma analysis shows north-south and east-west gradients, reflecting genetic risk and unequal access to care. Research on nevus counts confirms their value as dynamic risk markers shaped by age, sex, and height. A global review of skin cancer and albinism reveals a huge disease burden in Africa due to a lack of photoprotection and care. Chemoprevention studies expose gaps between prescriptions and patient adherence. Although sunscreens play a significant role in skin cancer prevention, the chemicals in the sunblocks may also pose a risk to human health and the environment. Together, these insights call for integrated and sustainable prevention strategies.
A clinicopathological challenge submitted by Liu et al. Presents a growing pink periorbital papule in a middle-aged man. The report describes the case of a 48-year-old man who presented with a slowly enlarging lesion on the right lower eyelid that had been present for 9 years. The skin biopsy revealed an apocrine carcinoma of the eyelid. In relation to this case, the authors delve into the clinical and histopathological differential diagnosis of apocrine carcinoma, along with treatment recommendations for these tumors.
Another noteworthy contribution by Jing et al., accompanied by a video abstract, reviews the role of stromal tumor environment in advancing skin cancer diagnosis and treatment. The stromal tumor environment plays a vital yet often under-recognized role in cancer progression, shaping tumor development. It influences complex interactions among stromal cells, immune cells, extracellular matrix components, and signaling molecules. Stromal cells regulate integrin signaling and are involved in remodeling the tumor microenvironment, driving critical processes such as cell migration, survival, angiogenesis, and proliferation. Advances in understanding the stromal tumor environment are creating new opportunities for early cancer detection and treatment. Innovations in molecular imaging, particularly for melanoma, are transforming cancer diagnostics by providing deeper insights into tumor biology, cellular interactions, and angiogenesis, paving the way for more personalized and timely therapeutic interventions. Among these advancements, in vivo skin fluorescent imaging stands out as a powerful tool, offering real-time molecular insights at the point of care with the ability to improve patient management.
In a multi-center, real-life study conducted in the Lazio region of Italy, Calderola et al. Investigated the effectiveness of bimekizumab in treating psoriatic arthritis. Bimekizumab, a monoclonal antibody targeting interleukin-17A and interleukin-17F, has shown efficacy in psoriatic arthritis clinical trials, but real-world data on its effectiveness are limited. The current study aimed to evaluate its real-world effectiveness in psoriatic arthritis patients treated in dermatologic settings. The authors carried out a multi-center, prospective, observational study in dermatology units across Lazio, Italy, including 20 patients with psoriasis and psoriatic arthritis treated with bimekizumab. Rheumatologic assessments were performed at baseline and after 16 weeks, evaluating tender and swollen joint counts, the visual analog scale pain score, the disease activity in psoriatic arthritis or DAPSA score, and the Leeds enthesitis index. Ultrasound evaluations of joints and entheses were conducted at baseline and week 16. 20 patients were enrolled, including 10 bio-experienced patients. At 16 weeks, significant improvements were observed in tender joint count, swollen joint count, VAS pain score, DAPSA, and LEI. Ultrasound revealed a decrease in the number of patients with power Doppler positive joints and a reduction in synovial power Doppler score. The number of patients with ultrasound positive enthesitis decreased from 50% to 30%, with a significant reduction in the enthesis PD score. 4 patients developed mild candidiasis with no treatment discontinuation. Bimekizumab demonstrated significant rapid improvements in real-world psoriatic arthritis patients, including those with prior biologic failures. Its favorable safety profile and effectiveness highlight its potential as a valuable treatment option.
A study by Yan et al. Explored the temporal and spatial trends in the global burden of acne vulgaris among women of reproductive age. Acne is a common, multifactorial skin condition with significant psychosocial and public health impacts. However, its burden among reproductive age women remains underexplored. Using Global Burden of Disease 2021 data, the authors analyzed acne incidence, prevalence, and disability-adjusted life years in female patients aged 15 to 49 across 204 countries from 1990 to 2021. Trends were assessed via age-standardized rates and estimated annual percentage change. Decomposition and inequality analyses identified contributing factors. Bayesian age period cohort modeling projected trends to 2040. From 1990 to 2021, acne incidence, prevalence, and DALYs rose by 34%, 38%, and 37% respectively. The greatest increases occurred in low sociodemographic index regions, for instance, sub-Saharan Africa. The 15 to 19 age group had the highest burden, but older age groups showed faster growth. Population growth was the key driver. Inequalities narrowed overall but remained complex. Projections show continued burden growth by 2040. The acne burden among reproductive age women is increasing globally, especially in low SDI regions and adolescents, underscoring the need for targeted strategies.
The last feature of our November episode is a short communication by Fagan et al., which examined discrepancies between patient-reported and physician-prescribed chemoprevention use among individuals with keratinocyte carcinoma after Mohs surgery. Most patients accurately reported their use of chemoprevention at both 6 and 12 months, though underreporting was more common than overreporting, especially for 5-fluorouracil and niacinamide. Patients with prior chemoprevention experience in older adults were more likely to misreport use, likely due to prior adverse reactions, self-directed use, or communication barriers. These findings highlight the need for improved patient education, adherence support, and tailored communication strategies to enhance chemoprevention effectiveness.
This was the November episode of IJD in Focus. Thank you for listening. Until next time.